Today, as we take a closer look at America's rapidly changing landscape, we find ourselves confronting a series of critical events, each one a signal of deeper systemic challenges, and each demanding not only our attention, but our understanding. In Washington, D.C., a tragic shooting has once again brought the issues of violence, ideology, and hate to the forefront. Two staff members of the Israeli embassy were fatally shot in front of the Capitol Jewish Museum, a cultural and historical landmark located just blocks from the heart of American government. According to eyewitness accounts and early law enforcement reports, the suspect, now identified as Elias Rodriguez, was shouting "Free Palestine" before he opened fire. This chilling moment, while deeply personal to those directly affected, has quickly become a national headline, raising urgent questions about political extremism, anti-Semitism, and the growing threat of domestic ideological violence. The suspect was arrested at the scene, and federal authorities, including the FBI, are now involved in what's being investigated as a hate crime with potential international implications. Leaders from the White House to the Israeli government to religious and cultural institutions across the country have condemned the attack, calling for calm, justice, and increased security measures for both diplomatic missions and vulnerable communities. But beyond the headlines, this event is just one of many signs that ideological divisions in the United States are becoming more volatile, more dangerous, and more visible. The rise in anti-Semitic incidents, Islamophobic rhetoric, and targeted acts of violence reflects a country where anger and fear are outpacing empathy and reason, and where words are increasingly turning into weapons. And while that tragedy unfolded in the nation's capital, a very different kind of emergency is emerging quietly but steadily across every American state. A new White House report has revealed a sharp and disturbing decline in the overall health of the U.S. population. For the first time in modern history, the life expectancy for Americans is falling, not due to a war or a single epidemic, but because of systemic, long-term failures in the way we approach public health, chronic disease prevention, and mental health care. The numbers are startling. Rates of obesity, diabetes, and heart disease continue to rise, particularly among lower-income populations and communities of color. Mental health disorders, including anxiety, depression, and suicide, are spiking, especially among young adults and teenagers, with emergency rooms across the country reporting higher rates of psychiatric crises than ever before. In rural communities, hospitals are closing, care is delayed, and entire regions are left without access to critical services. The report also highlights the deep disparities that exist within the system, where zip code, income level, and race can predict the quality of care you receive, or whether you receive care at all. What's perhaps most alarming is that these issues are no longer theoretical. The United States is now consistently ranked below other developed countries in healthcare outcomes, despite spending more per capita than any other nation in the world. Experts are calling this a full-blown public health crisis, one that affects not just our physical well-being, but also our economy, our workforce, and the future of our children. Without urgent policy intervention, investment in preventive medicine, and a shift in how we talk about health, the U.S. risks becoming a nation that lives shorter, sicker lives despite its technological and medical advancements. But that's not where the urgency ends. In another major development today, energy markets are reacting strongly to news that U.S. crude oil stockpiles have reached their highest levels in months, causing a sudden and significant drop in global oil prices. For everyday Americans, this might seem like welcome news. After all, lower oil prices can translate to lower gas prices, cheaper airline tickets, and some relief from inflation at the grocery store. But for investors, policymakers, and energy producers, this drop is a signal of instability in one of the world's most important economic sectors. The price of West Texas Intermediate, a benchmark for U.S. oil, plunged after government data revealed that supply was outpacing demand by a wide margin. This oversupply is not just about a warm winter or lower travel demand. It's also a reflection of a larger, more complex shift taking place in the global energy landscape. The United States is producing more oil than ever before, but demand is slowing due to increased energy efficiency, global economic uncertainty, and, perhaps most importantly, the global push toward renewable energy sources. Solar, wind, and electric vehicle markets are growing rapidly, and major nations are beginning to transition away from fossil fuels. In response to the price drop, all eyes are now on OPEC+, the coalition of oil-producing nations, to see whether they will cut production to stabilize the market. But geopolitical tensions, internal disagreements among member countries, and the growing independence of American oil producers complicate any easy solution. The consequences of these developments could affect everything from job markets in energy-rich states to U.S. foreign policy in oil-dependent regions, to the broader fight against climate change. What ties these three stories together? A politically charged shooting, a healthcare system in decline, and a volatile energy market is more than just timing. It's the story of a country grappling with major transformation on multiple fronts. In every case, we see underlying themes: the erosion of public trust, the impact of inequality, the consequences of delayed leadership, and the mounting pressure on American systems to adapt to a new and fast-changing reality. Politically, ideologically, economically, and socially, the United States is being tested, and not just by external threats, but by internal strain. And while these stories may dominate headlines for a few hours or days, their deeper implications will shape the trajectory of American life for years to come. Will we choose to invest in unity over division, in health over profit, in long-term sustainability over short-term gains? Or will we continue to let political gridlock, profit motives, and cultural polarization prevent real progress? For millions of Americans watching these headlines unfold, the question becomes deeply personal. What can I do? How can I make a difference? The answer may begin with awareness, being informed, paying attention, asking critical questions about how policy, ideology, and money shape our lives. It also includes action, voting, engaging in your local community, demanding accountability from leaders and institutions, and making choices, however small, that move our society toward empathy, equity, and long-term resilience. Whether it's supporting mental health in your workplace, pushing for safer schools and communities, or embracing cleaner, more sustainable technologies in your home, the ripple effect of small actions can be profound when multiplied across millions. So, as we wrap up this critical update, we ask you to reflect not just on the events themselves, but on what they represent, and on what kind of country we want to live in and leave behind. The world is watching. History is being written in real time. And you, the viewer, the voter, the citizen, are not just a witness. You are a participant in what comes next. If these stories matter to you, if you believe in the power of information and the importance of asking tough questions, then we invite you to be part of this journey. Subscribe to this channel, share this video with others who care about our collective future, and leave a comment below with your thoughts.